Welcome to today's deep dive. Usually when we talk about a medical diagnosis, there's this comforting expectation of precision. Like it's treated almost like mechanical engineering.
Right. Yeah. Very binary.
Exactly. You break your arm, the x-ray shows a jagged white line, and the doctor just points at the glowing screen and says, well, there it is. That's the problem.
The relief of the visible, I like to call it. Broken or not broken. We really like things to be neatly categorized.
We do, but then, you step into the world of chronic pain and particularly women's reproductive health, and suddenly that x-ray machine it's just utterly useless.
Oh, completely. It's a completely different landscape.
It really is. We are looking at a diagnostic landscape that is incredibly murky, which brings us to our mission for today. We are looking at this highly personal, really paradigm-shifting article from the Sacred Return Journal.
Yeah, it's a fantastic piece.
It is. It was written by Dr. Ntsele, and it's titled, My Period Pains Were Communicating a Bigger Problem, Endometriosis. Now, to be clear to you listening, this isn't just a clinical medical case study.
No, not at all. It goes way deeper than that.
It is a profound exploration of how society literally conditions us to ignore our bodies. So we are going to look at the dangers of normalizing chronic pain and how reframing our relationship with physical suffering can unlock true healing.
The source material here challenges some of the most deeply ingrained assumptions we have about what our bodies are actually trying to tell us.
Yeah.
And more importantly, how our medical systems interpret or, I guess, fail to interpret those signals.
Okay, let's unpack this because Dr. Ntsele's story does not start with a quick fix. It starts with a staggering timeline. She got her first period when she was 17 years old.
Right.
And from that exact moment, she endured what she describes as gruesome period pains. Not discomfort, mind you, gruesome, debilitating pain.
Yeah.
And she dealt with this for 14 years.
14 years is just, it's an enormous portion of a person's life to be living in a state of severe, recurring physiological trauma.
Yeah.
It fundamentally alters your nervous system.
Yeah, it was so bad that she actually opted to go on contraceptive pills for the sole purpose of not getting her period at all.
Just to avoid the pain.
Right, she was just trying to avoid the agony. And the heartbreaking part is the rationale she was given for enduring it. She writes explicitly, I endured all this pain because I was told that period pains are normal.
What's fascinating here is how normalizing pain creates this really dangerous blind spot. And not just for the patient, but for the entire medical apparatus treating them.
Right, because it's just expected.
Exactly. When a society collectively decides that excruciating pain is just a standard, unavoidable part of the biological female experience, it leads to systemic medical dismissal.
Wow.
The pain is no longer seen as a symptom of an underlying disease process. It's reclassified as a behavioral burden you just have to, manage.
And we see that systemic dismissal right in the text. Before she ever got a proper diagnosis, Dr. Ntsele was seeing another gynecologist for over 2 years.
For 2 years, yeah.
And his grand diagnosis for this agonizing pain was hormonal imbalance.
A remarkably broad label.
Yeah.
It's the diagnostic equivalent of just shrugging your shoulders.
Yeah, it sounds official but means nothing.
Right. It often stops the investigation in its tracks because it sounds clinical enough to be a conclusion, but vague enough to avoid targeted treatment.
Well, his treatment plan was honestly wild. He suggested she take contraceptive pills on completely random days, claiming that would help balance her hormones.
Random days. That's just...
Unsurprisingly, it didn't help. She notes the period pains actually got worse because they hadn't identified the actual source of the problem.
Of course they got worse.
If this random pill approach, it's like putting a piece of black tape over your car's check engine light instead of actually looking under the hood. You're just trying to cover up the flashing warning sign so you can keep driving.
You are disabling the alarm while the engine is seizing up. If we connect this to the bigger picture, this raises an important question about medical methodology, particularly regarding chronic pelvic pain.
How so?
Well, when the standard of care becomes symptom suppression rather than root cause analysis, we leave patients trapped in cycles of worsening health. Investigating complex pain takes time. It takes resources.
And a willing doctor.
Exactly. A willingness for a doctor to admit they don't have an immediate answer. It is significantly easier for a strained medical system to prescribe a standardized suppression tactic, like arbitrary birth control, than to dive into the complex, often messy reality of what's actually happening inside the body.
Which makes me want to ask, why are we as a society so quick to accept pain as a default setting? Like, rather than treating it as an alarm system, We wouldn't ignore a fire alarm in our house, but we routinely swallow pills to silence the alarms in our own tissue.
It's a great question. Historically, women's pain in particular has been heavily minimized and, well, psychologized.
Right, the whole hysteria thing.
Exactly. There's a documented legacy in medicine of attributing female physical suffering to hysteria or just having a low pain tolerance. And that cultural baggage trickles down into modern clinical encounters.
So they just don't get treated as fast.
Right. It results in women waiting years longer than men, on average, to receive accurate diagnoses for identical pain symptoms.
Man, that brings us to the turning point in Dr. Ntsele's story. The real breakthrough only happens because she needs a second opinion.
Yes.
And she didn't go to a specialist because her daily gruesome pain was finally deemed severe enough to warrant deeper investigation.
No, she didn't.
She went because she was having trouble conceiving a baby.
The shift in medical attention and diagnostic rigor only occurred when the issue transitioned from a woman's personal daily suffering to her reproductive capability.
Isn't that just tragic? Her pain was only fully investigated when she was trying to have a baby. What does it say about our medical system that a woman's pain is often only taken seriously when it impacts her fertility?
It highlights a massive structural flaw in how we triage reproductive health. It suggests the system values the potential of a biological function more than the current well-being of the human actually housing it.
It's so frustrating. But she does visit a specialist, Dr. Kasim, and he does an internal ultrasound. He literally looks at her womb. And what he finds is astonishing.
Yeah, it wasn't a vague imbalance at all.
Not at all. It wasn't just some hormonal imbalance. She had endometriosis stage 2. Let's actually pause and define what he found. Endometriosis is a term thrown around a lot, but the mechanics of it are, they're brutal.
Brutal is the most accurate word. For anyone listening who might not be familiar with the pathology, endometriosis occurs when tissue that is structurally similar to the lining of the uterus, the endometrium, starts growing outside of the uterus.
Meaning it's growing on the ovaries, the fallopian tubes, the tissue lining the pelvis.
And here's the mechanical nightmare of that condition. That rogue tissue continues to act as it normally would inside the uterus during a menstrual cycle.
Yeah.
It thickens, it breaks down, and it bleeds. But unlike the normal uterine lining, which exits the body, this trapped blood has nowhere to go.
It just pools internally, right?
Exactly. Causing massive inflammation, scar tissue, and eventually structural binding.
Which is exactly what happened to Dr. Ntsele. The ultrasound revealed her womb was retroverted, meaning it was tilted backward and fused into that position by the disease.
Fused in place. Just imagine the pain.
She actually had to undergo a minor operation just to identify what was holding it in that position. On top of that, they discovered a bleeding cyst on her left ovary.
So suddenly, the 14 years of gruesome pain make complete physiological sense. There was active disease, structural abnormality, and internal bleeding. It wasn't in her head, and it wasn't a normal part of womanhood.
I want to read Dr. Kasim's exact quote to you listening because this is the absolute crux of the article. This is what he told her after looking at the ultrasound.
Please do.
Quote, "Judging with how your womb looks like, you must have experienced extreme period pains. I know you people are told that period pains are normal, but they are not. It's how your body communicates with you that your womb needs your attention. You're lucky to have come here now. Any time later, we would be talking a different story. You must go and tell others that. Period pains are not normal." End quote.
That statement is profoundly powerful. Notice what he's doing there. He isn't just diagnosing a disease.
He's validating her.
Exactly. He is validating a decade and a half of a woman's lived reality. He is taking the societal narrative that this level of pain is normal and dismantling it structurally right in front of her.
Yeah.
That validation fundamentally changes Dr. Ntsele's relationship with her own body.
It really does.
Yeah.
Because his validation that pain is a communication sparks something incredible in Dr. Ntsele. It inspires her to completely redefine the concept of pain itself.
The rebranding of pain from an enemy to a messenger.
Yes. She comes up with an acronym that I think is going to stick with everyone listening to this. She takes the word PAIN and turns it into pay attention in now.
Pay attention in now.
Let me repeat that. Pay attention in now.
It's a brilliant cognitive shift. She is positing that when you feel pain, your body is giving you a real-time, undeniable indication of exactly what needs your attention at that very moment.
It takes away the fear, right?
Right. It removes the panic from the sensation. You become an active observer of your own biology rather than a passive victim of it.
She gives some really practical examples in the text. Let's say you get a headache. The acronym dictates that you don't just immediately reach for the medicine cabinet to obliterate the sensation. You pay attention to it.
You observe it.
First thing you do is drink water. Triage the most common underlying cause, which is dehydration. If the pain doesn't go away, you don't ignore it. You observe it. Which side of your head hurts? What kind of throb is it?
Because paying attention in the now gives you the specific data a doctor might need later to find the root cause.
But what happens when the pain isn't immediate, though? How do we interpret delayed signals? She frames this using a brilliant analogy about bumping into a door.
Oh, I love this analogy.
Right. Say you bump your arm against a door frame as you walk past. You feel a small sting of pain, and it passes pretty quickly as the blood starts flowing. But a day or two later, you touch that exact spot, and boom, it hurts again.
That secondary pain isn't a new injury.
Exactly. As she explains it, at that moment, the pain serves as a reminder to you that you experienced trauma earlier. It's a delayed signal that the initial impact still needs care. It hasn't resolved just because the initial sting faded.
Because pain is deeply evolved biology. Ignoring it or numbing it so you can push through your day creates more harm because you are allowing the root cause to fester unobserved. You're essentially shooting the messenger while the castle burns.
Okay, I have to play devil's advocate here, or at least speak for the realities of modern life.
Go for it.
This sounds incredibly mindful in theory, but in the middle of a busy workday, on a Tuesday when you have 3 deadlines, your inbox is a disaster, maybe you're managing a chaotic household, it is just profoundly easier to pop a painkiller.
Sure, is.
Is it truly practical to stop and deeply analyze every single ache we feel?
Well, I would argue that the chaotic modern Tuesday you just described is the exact reason her framework is necessary.
Oh, interesting.
The modern workday is predicated on dissociation. We are economically incentivized to ignore our bodies to maintain productivity. But Dr. Ntsele is careful to differentiate between immediate triage, like drinking water for that headache, and the chronic, unaddressed suffering that defines so many lives.
So it's not about never taking an aspirin.
Right. Popping a pill once to get through a presentation is one thing. Taking pills on random days for 14 years to avoid dealing with a bleeding cyst is the systemic habit of silencing she is warning against.
Got it. It's the difference between turning off a car alarm because you accidentally bumped the bumper versus cutting the wires to your fire alarm because the noise is bothering you while your kitchen is literally in flames.
That is a perfect way to put it. And once Dr. Ntsele finally understood why her fire alarm was ringing, once Dr. Cassine gave her the structural map of her womb, she faced a new crossroad: how to heal it.
Because she was initially told that to manage the pain, she'd basically have to live on pills for the rest of her life.
A lifelong management plan, which is unfortunately standard protocol for chronic conditions like endometriosis.
But she rejects that path. The resolution of her story is frankly astounding. She writes that she has been completely pain-free and free of all endometriosis symptoms for over 10 years.
10 years.
Best of all, she emphasizes that her womb remains intact and healthy.
10 years of symptom-free living with a condition that is notoriously difficult to manage. It's vital we explore how she approached this phase of her journey.
It is. Now, she achieved this not by staying on the lifelong medication she was prescribed, but by turning to ancestral indigenous sciences and working with nature.
Right.
She highlights this crucial advice to, quote, know what is the spiritual meaning of that disease. She advocates for listening to the body, trusting intuition, and acknowledging that while pain is natural, suffering is the prolongation of pain caused by ignoring it.
What's really compelling is the beautiful synthesis here. Dr. Ntsele used modern medical technology, the internal ultrasound, to get the concrete diagnosis.
Right.
She needed Western medicine to see the retroverted womb.
Right. She needed the visual.
Exactly. But she utilized traditional indigenous wisdom and emotional and spiritual introspection to achieve long-term holistic healing. She didn't reject one for the other, she integrated them.
Here's where it gets really interesting. It's like translating a foreign language. Her body was screaming at her in a language she didn't speak. The modern doctor gave her the dictionary to identify the words, the diagnosis. But her ancestral science taught her how to actually understand the poetry of what her body was saying.
The diagnosis is the vocabulary, but the holistic integration is the fluency. Her journey from a patient suffering in silence to becoming a sacred relationship healer offers a blueprint for anyone dealing with chronic issues.
It's just such a triumphant place to land.
They really is.
And that brings us right to you listening to this deep dive right now. I want you to really reflect on Dr. Ntsele's journey. Whether you have a womb or not, we all have bodies that try to speak to us.
Every single day.
Are you currently masking a physical or emotional symptom just because society tells you it's normal to feel that way?
Uh,
Are you putting black tape over your own check engine light?
the cost of ignoring the alarm is always far higher than the cost of answering it.
The core thesis here is undeniable. Pain is a messenger asking for your attention right now. Stop suffering by ignoring it and start listening.
The messenger will keep knocking until you answer.
We want to leave you with a lingering, provocative question to mull over today. If you viewed every physical ache or discomfort not as an enemy attacking you, but as a devoted friend desperately trying to warn you, how would your daily routine change tomorrow?
It changes everything.
It really does. Thank you for joining us on this deep dive. We'll catch you next time.